Hi guys and welcome back to my YouTube channel. Today I am joined by RUMAIL, who is a third-year medical student at KCL.
Hi guys.
Yeah, say hello RUMAIL. And yeah, today we're just going to be giving you guys a bit of a review on our experience at King's and how I found dentistry and how RUMAIL has found medicine, and you know, whether or not it's as good as people say it is.
Okay, so from a medicine point of view, like when I applied, which how many years ago was it now? 3 years ago. So yeah, time goes quick. Yeah. So yeah, what my biggest expectations from like going into medicine was that I thought like it'd be a very hands-on experience from day one, and there'll be a lot of clinical exposure straight away, and it won't overlap with A-level at all. But to be honest, it was a lot different in many ways. So when I initially came to medical school, like in my first few weeks, I was already looking forward to dissection, and in dissection, prior to applying, everyone was like, "Oh, dissection is very cool. You get to see the whole real human body and like get a proper 3D perspective of it. It's great for your learning." But when I actually went into dissection session, it was a very mixed opinion. Some people were fainting. So
there's always someone that has to faint in the session. It's just like a classic rite of passage.
And they were like, so when I first saw the cadaver for the first time, that was quite a moving experience, to be honest. But it was nothing like I expected. It was like a lot less lifelike, like I thought, because you know, because they've been, as many of you, I don't know if you've seen them, but they've been like a lot of chemicals have been used to like preserve the body. So it's not like me and you right now. But when it comes to clinical exposure, so in the first year, like in the first couple of years, there was basically no actual patient-to-patient contact. It was just more simulated stuff. So in King's, we have this whole building called the Chandler Center, where we have dummies, where we have like mini fake wards, and over there we went there to do blood pressure. We learned blood pressure in the first few years, and we did like how to do examinations, so like chest examination, etc. That was quite cool, but at the same time it wasn't like I knew from many other medical schools, some people get exposure from day one. Like one of my friends at Brighton Medical School, he was assigned to a newborn baby from week 2, and they were following them throughout the year and going to their house, so that was quite cool. But over here, when I started, it was more just doing lectures. 9 to 5 was full, very intense. Like the first year definitely was very intense on lectures, and as I'm sure was the case with dentistry as well. But yeah, so and majority of it overlapped with A-level, and that was something I didn't expect. I thought I've left A-levels behind, but then I thought, oh no.
You thought wrong, trust me. Like,
why is A-level coming back to haunt me?
It's gonna come back.
Why do I need to do pH titers?
It's gonna keep going.
But yeah, apart from that, so summing up my first few years, I think they were a lot less clinical that I hoped for or that I was expecting. But yet again, it was quite a good experience, like learning the simulated stuff. Overall, I'm very happy with how it's been.
So yeah, so with regards to what I was expecting from dentistry, I instantly thought, okay, I'm going to go in, and the first few weeks I'm going to see some teeth, get right in there, see some phantom heads, and like get really nitty gritty. Because I'm sure any of you that are applying for dentistry, maybe not as much for med, but for dent, there's this like term, manual dexterity, that always gets thrown around. So you need to make sure you've got manual dexterity. You might go to like these interviews where they tell you to do like really intricate tasks.
If you're an artist, you're
exactly. If you're going to be an artist, you're going to be the world's best dentist and stuff like that. So I really thought that from the get-go, I'd have a lot more like practical exposure, not even clinical. But unfortunately the case was, you know, it was more, let me just do some A-level biology part 2. You'd think that you'd done A-levels for a reason, but first year of medicine, first year of dentistry, it's a lot of like just biomedicine. It's just a lot of content that you think you knew before, but they literally, I had to relearn enzymes, I had to go over like pH, I had to go over so many things, like why am I doing this again?
One thing was, you know, the Krebs cycle we did in A-level biology, and that one step they summarized in A-level biology had 20 steps within it. I was like, what the how, when, where?
So much, like, it just, you know how people say the step up from GCSE to A-level, like everything you learned at GCSE was wrong? Well, university and A-level, everything you learn at A-level was wrong. So literally, that's something you need to be ready for. The main thing I'd say is, one thing I didn't expect was how much, you know, like content there was to learn. Like there's just so many lectures and so much content you need to know. Just to sum it up, so my expectations were I'd have a bit more, you know, practical work early on, and I wouldn't have so much like sciencey stuff to do, like basic like biology and chemistry, but it's just the complete opposite. In your first year, that is actually the 99% of the stuff you're going to be doing is just like biomed, and it's just going to be biology, chemistry, like simple stuff that's just been overcomplicated for you. Where I felt like it sort of shifted a bit more was second year, and that's where I personally had more dentistry content. So we learned more about the teeth, which is kind of not the point. we got to work on phantom heads. We got to work on like caries and understanding the different like diseases and infection process. And I think RUMAIL, you probably had the same thing, like in terms of your
Yeah. So then after moving on from first year, then it went. It was a bit more clinical exposure. Still, as not as much as, let's say, Faris did in dentistry, but we were seeing GP once a week and hospital once a week, so Tuesday, Friday, and it was good to see like two different settings, because when you think of a doctor, it's either a GP or in hospital. So I think it was very good like insight into both aspects. Even though you're not doing much, like you're more hands-on, but we were just more shadowing, seeing how the doctor goes about the daily life, observe a surgery here and there, but nothing like hands-on. But more on the other hand, you were a lot more like learning how to do root canals and stuff.
I feel like when we're thinking about this whole medicine versus dentistry thing, the big differentiator I felt is just that with dent in second year specifically, there's just a lot more hands-on work. With med, it's more observing, it's more shadowing, it's more along the lines of, okay, let me look and learn. And with dentistry, it's more like, let me just get my hands in there as quickly as possible and get as much work done.
I think like for medicine, they like, as I've heard as well, that you don't get like hands-on until year 4. That's when you actually start going on to like, when you go on the ward, the FY1 will be like, oh, Rumail's a year 4 medic, he can help me with this. Because I think once you're below year 4, like year 3, year 2 or year 1, if you are
the value is just your stock is underground, like they don't care.
You're more of a burden there.
Definitely. For dentistry, if COVID hadn't happened, I would have probably had my first patient in when would it have been? Like near the end of last year, so the end of second year. So we get clinical exposure very, very, very early on. Even though I wish we had it a bit earlier. In general, there are quite a few differences between dentistry and med, obviously. But in terms of the teaching style, I'd say like our first years were near identical. And I feel like the deviation starts from second year onwards. And that's where you have like your clinical exposure.
So he'll be more in clinics doing hands-on patients or them, and mine was more like shadowing and stuff. So but I think by the end of I think near year 4 or 5, it'll be more. You'll be fully in clinic. I'll be fully in hospital. Hands-on involvement. So there's two different perspectives for clinical exposure, but we do get there at the end.
Exactly. Okay, so I hope you guys found that useful, and I know there's so many questions people like to ask about how is dentistry at King's or how is medicine at King's and stuff like that. So I hope in this video you kind of got an insight on what our lives are like and what you should be expecting. And I guess the main thing, is a bit pessimistic, but you might not be seeing patients as early as you might like. But I think the reason for that is because there's so much content you need to learn, and there's just so much background knowledge you need to have. It gives the reasoning for that step.
The key is you need to be ready for it.
So I hope you guys enjoyed that video. Feel free to like, comment, subscribe, and hit the notification bell to stay up to date with all the vids. Also, make sure you check out RUMAIL's channel. I'll have all the links down below in the description and pinned in one of the comments. And if you guys have any questions about King's, dentistry, or medicine, make sure you drop us some DMs on Insta as well. I'll have those linked below. Anything you want to say?
Thank you so much for having me over, Faris.
All good. Cheers. Alright, hope you guys enjoyed. Safe.